We worked in splendid isolation. We were absolute islands in our local system.
Patients were very vocal. There was a lot of social media, a lot of information in the press about patients unable to get an appointment.
Communication wasn't as good as it could have been. So we knew we didn't achieve the very best for people.
In our worst days, we couldn't organise transport, we couldn't organise care packages, there were arguments about budget and funding and all of those sorts of things.
A real sense of disappointment at the lack of coordinated care.
And we have far less of that now. It's a marked difference from what it was like 5 years ago in Swindon. Up until a few years ago, the only thing that the 3 hospitals across the ICS had ever worked on was bowel screening programmes, so we didn't really have a track record of working together. We came together to develop Wiltshire Health and Care as a provider of adult community services across the county of Wiltshire, and that forced us into a position to really start paying attention to what other organisations were doing, how we could share best practice and learning.
We were also building relationships with the local authority, which had also broken down in previous years. So 2019 was new shoots of working together, I suppose, had started around that time.
There's been a wholesale change in leadership across executive teams in those organisations, new people coming in with new ideas from other parts of the country that's really given us a bit of a different perspective on what we can do across the ICS, what we can do for our communities, and also start to sort of wipe away some of those competitive boundaries that existed, where you often thought that actually the reason the trust down the road was interested because they wanted to compete, they wanted to take that service, and we've managed to work together and sort of rub away some of that history.
Over a number of years, the practices had been in decline. A number of GPs, partners had retired, and it had been really difficult to recruit GPs into the area. The CCG asked if the Great Western would take over the management of 2 practices.
We recognised the importance of that system leadership contribution.
The Trust felt that we had an ambition to be part of a much more integrated system, and therefore it was the right thing to do.
So we're on a learning curve at the moment, but we've managed to take those practices, the 2 that we're responsible for, about 30,000 patients, out of special measures. We want to get them to good and ultimately to outstanding. I think the great opportunity is that we've got the chance now to be able to try looking at pathways in a completely different way, because we have our primary care network, our community services and secondary care, and do things that previously would have butted up against organisational boundaries, and there would have been an easier excuse for us to back away and say we can't make it happen. I think we'll start to see some very big steps forward in how we're providing care, and I think that's what we've seen when we took on community services, and that's what gives me some confidence. Albeit we knew something about community services, primary care we are still learning.
When we all became aware that COVID was a much more serious virus than perhaps we had initially begun, we did come together as a system in a way that we'd never done before.
When the COVID pandemic hit us, it happened at incredible speed, and we literally changed the way we worked within 2 or 3 days. We changed the way our social work staff worked with the ward staff, worked with the hospital discharge team within Great Western Hospital to have that daily communication, a daily review of every patient who was ready to leave hospital. And that led to much closer working relationships.
There was opportunity there to move to virtual appointments, both in primary care and in secondary care here, to actually force us together more around that singular mission to care for the number of people that in the community that had COVID and the number of people in the hospital that would need hospital treatment. So we moved really quickly, and it really did bring people together in a way that I haven't seen before.
What I've also seen is mutual aid across the system. Primary care practice nurses supporting community nursing staff, domiciliary care providers and therapists working together in a way that perhaps they would not have done before.
We can talk about integration and the theory of it, and we all get the benefits of it, but there was something about COVID that brought us together that meant that we were sharing our PPE, we were sharing our expertise, we were looking at different roles, different ways of working, and I can honestly say that it did feel like a single team. That didn't feel like there were organisational boundaries and things like that.
I think what this whole experience has shown us is that when we work together, we can actually make a huge difference to people's health and well-being.
I don't think we would be prioritising health and social inequalities in the way we now are if we hadn't worked together like this over the past year.
The real sort of gold out of all of that is how do we take that into what is business as usual integration and not revert to type and pull back into our organisations. And that's really where we're at the moment, trying to hold on to some of the gains that we made over the past 18 months or so. It definitely feels like it's more of a team endeavour now rather than us standing in splendid isolation thinking we can solve all of our problems on our own.